Okay, it's recording. Yeah, okay. Okay. Okay, question one. So which one, what do they always require? Very good. See, just definition stuff. Easy. What's an example of a primary active transport? There's a bunch of them. What are some of them?
Sodium, potassium, ATPase.
What else? Calcium ATPase. The MDR, that multi-drug receptor extruders, but just know those first two. What's the purpose of that sodium potassium ATPase pump? Bring it back to resting membrane potential. Get all those ions back where they're supposed to be to keep those gradients there. What's the most common type of passive transport? Well, no, ion-gated chain. Passive transport. What's the name of the force that opposes osmotic pressure? Hydrostatic pressure. Remember, osmosis is movement of water. Hydrostatic pressure is kind of keeping it stuck. What will happen to a cell if you bathe it in a hypertonic solution? What is a hypertonic solution? Higher than the solute in the saline. So what percent is that? 0.9 above. So 1%, 2% saline. Okay, so it's going to shrink. Very good. These are the type of questions. You're just going to have other responses that will trick you maybe. I don't know. Hopefully not. Okay, what ion is responsible for rapid dipole?
Sodium.
Sodium, very good. What is responsible for the absolute refractory period? That sodium inactivation gate. They haven't reset yet, so nothing's going to happen. Everyone good? Okay. The speed of conduction is enhanced by the presence of what? Myelin. Okay. How are electrical synapses joined? These are your gap junctions. Very good. What neurotransmitter is released at? Yeah. Acetylcholine. all neuromuscular junctions are always going to be acetylcholine. Always acetylcholine. And what's the receptor? Nicotinic receptor on the postsynaptic side. What enzyme breaks down acetylcholine? Yes, easy. They already gave you the answer in the word. How many proteins are in a troponin? Three. Make sure you know what they do. Okay, so I inhibitory, C binds to calcium, T anchors your troponin. Okay. What two items must be present? ATP and calcium. Okay. Why is the calcium important? It binds to troponin. Which troponin does it bind to? C. And what does that do? Exposes the active site so you can have a cross-bridge form. What ion is responsible for excitation-contraction coupling? Calcium. Remember, anytime you see contraction, calcium. Always calcium. Calcium will become very more important when we get to cardio because calcium has a bigger role in the whole depolarization of the heart. What's tetany? Constant stimulation to a point where there's no time for relaxation and the muscles just freeze up. And tetanus. Yep. Can't relax between stimulations and contractions. Okay, Usain Bolt would have more what muscle fiber type? Fast twitch. Okay, type 2. Slow twitch is type 1, and more distance runners will have those type of fibers. Everyone feeling more comfortable now about the exam tomorrow, hopefully? Okay. Yes, like I said, guys, this is your definition course. Know the words, because when you get to your more advanced classes, They're just going to talk about these things as if you already understand what they are. Okay? That's where I want you guys to get at. I hopefully also want you guys to get to the point where you can look at stuff online and see how much crap is out there. Okay? There's a lot of misinformation from medicine out there. If you watch like Grey's Anatomy, you can see all the crap that goes on in that show. Hopefully by now you start realizing some things aren't really true in the way they work normally. Okay, what is preload? This is the resting muscle passive tension. So again, if you're holding onto a 5-pound dumbbell in your arm and you're just holding onto it, that is the preload. It's the resistance on the muscle before tension is applied. All you're doing is holding. Now I'm moving it. Now that's afterload because I have to overcome that weight to keep it moving. What's the relationship between force and velocity? Yep. Speed of shortening decreases as the load increases. The heavier the object, the slower you can move it. Think of a 5-pound dumbbell versus a 50-pound dumbbell. You can't go as fast with the 50-pound dumbbell because it's too heavy. Too much smooth muscle stimulation can cause what? Asthma attacks, high blood pressure. Remember, smooth muscle stimulation, bronchus closes up, gets inflamed, swells. The amount of air that can get in goes down. Start getting wheezing. High blood pressure, all your arteries constrict. And when you get to cardiac in a week, as you constrict the vessel, the pressure goes up. That's why you get high blood pressure. Too little vascular smooth muscle stimulation causes what? Now we're doing the opposite with the vessels at least. We get extreme vasodilation. Nothing's holding those vessels, keeping the tone there. And you get pressure drop hypotension with that vasodilation. Okay, as your vessel gets bigger, you need more blood in there to keep the volume and the pressure up. But the diameter is too big, not enough blood flow, your pressure just drops. The next unit we're going to do is blood at first. We'll just take one lecture and we're done. But then cardiac and pulm is all physics-based, so hopefully you brush up on your physics. We have a couple of formulas, not many. Ohm's law is there. All that fun stuff from undergrad, it all comes back. Now, we're still in smooth muscle. What does calcium do for smooth muscle? What does it bind to? Calmodulin. That's what causes those cross bridges, the calcium calmodulin complex. That's only in smooth muscle. Okay. What enzyme is responsible for relaxation of the smooth muscle? There's 2 longer words. They had 4 words. Only the last one changes. There's kinase and there's phosphatase. Which one relaxes the muscle? Good. Myosin light chain phosphatase relaxes it. Myosin light chain kinase activates it to cause that latch bridge state so you can maintain those long contractions with very little use of energy. We just talked about that latch bridge. So moving on. What's an example of innate immunity? Skin. Remember the things that we're born with. Okay, skin, mucous membranes, phagocytes, dendritic cells, natural killer cells. These are all innate immunities, things that we're born with. What white blood cell is first to come to an infection? Neutrophils are the first one. Just remember I forgot the last one is, but neutrophils, macrophages, and lymphocytes, I think it is. What type of T lymphocyte presents the antigen to the B cell? Helper cells or CD4 T cells. They're interchangeable because CD4 is the receptor on those T cells. What's IgA? Yes, I know it's an immunoglobulin. I know it's the A one. What does it do? Okay, saliva, mother's milk. Remember, this is in the saliva, so breast milk. It's again, this is passive immunity because it's going from the mother to the infant. And remember also animals licking their wounds because they have the IgA in the saliva to help clear out any infections in the wound. Example of passive. Mother to fetus, mother to child, and antidote or snake venom. Remember, with the antidote, snake venom, we just give you the antibodies. There's no reason to develop an immunity to rabies. Hopefully you get it once, you never get it again. So on. Okay, second round. What's special about phasic receptors? Does it decline over time or keep going? Okay. Quickly adapting by decreasing the response. So smell, touch, temperature. You come into a room, you might get cold at first, but after a minute or two, you get used to the temperature and you're okay. Because that temperature hasn't changed, your receptors have just gotten used to it, and they stop responding so you don't notice it. What sensation do Merkel's discs respond to? Okay, this is touch. Indented pressure, so like when you indent the skin and you push down, Merkel's discs handle that. What muscle causes constriction of the pupils via parasympathetic? This is your circular. And what's that going to do to your pupil? Constrict it. What structure secretes the aqueous humor? Ciliary bodies. Calcium drains it away. What occurs to the eye during accommodation to a target far away? It dilates. Under what response? Sympathetic. What muscle is activated? And what's going to happen to the eye? Pupil? Dilates. Okay. Ciliary muscle relaxes, causing that lens to thin and flatten. I'm sorry, that's pupil size. This is talking about the lens. So the lens is a ciliary muscle. Remember, we talk about near and far. When we're near vision, the ciliary muscle relaxes and the lens changes shape to allow for near sight. When you look far away, when near, the ciliary muscle contracts. It causes the eye strain. So at near vision, the ciliary muscle contracts, like the lens changes shape, allows you to see near things. That causes eye strain because that muscle is constantly being contracted so you can focus on near things. When you look far away, ciliary muscle relaxes and the eye strain goes away. What type of photoreceptors allow black and white vision? Okay, these are your rods. Remember that black and white night vision? Okay, here we go. Told you there's one question. Light coming into the left eye via the lateral field, so left lateral field, project onto what part of the retina? Okay, medial or the nasal area of the retina. Remember when you're studying that one, know the field of vision that I'm telling you first. Where on the retina is that going to project? And then where does it go from there? How many fields of movement can the ears detect? How many, you have vertical and horizontal movement, and what two structures determine that? Utricle and your saccule, and then how many of those semicircular canals do we have? Three. So we have five. 5 ways of movement. What's the apparatus that allows you to hear music and convert sound waves to electrical signals? The organ of Corti is the actual structure that does it. Well, we already did that one. Okay, what's the front tooth? Facial nerve. What kind of cells form myelin sheath in the CNS? Okay, what does it in the periphery? Schwann cells is in the periphery. What neural cells promote the blood-brain barrier? Astrocytes. And what kind of special thing do they have? Podocytes. And that covers the entire capillary, so nothing can leak out. Why do inhibitory potentials have the advantage over excitatory? It's all about location. Remember the axon hillock, right before it gets to the cell body, that's where the inhibitory ones are to shut down any excitation that can come in. If the inhibitory one was too early, any excitable tissue after that can send that signal through. So by having it so close to the end, we can stop any signals from getting through, thereby inhibitory. What lobe of the cortex is responsible for visual processing? Occipital, very good. What part of the brain is responsible for forming words? Broca's, very good. Where are memories stored? Hippocampus. Just remember Elemental, whatever that movie was. What part of the brain can attenuate aggression? Frontal lobe attenuates. Remember, you can do something dangerous if you want, but your frontal lobe is going to tell you not to do it. So it attenuates that aggression. What kind of brain waves are found during deep sleep? These are your delta waves. What system, parasympathetic or sympathetic, has short pre and long post? Why does sympathetic have short pre? But what is right next to the vertebrae? Sympathetic side chain ganglia is right there next to the vertebrae. Sympathetic side chain. We know it's all sympathetic. So they go right there first to the ganglion, and then it goes wherever it's got to go. So they're all short for the sympathetic because of that side chain ganglia they all go to first. So this one is your sympathetic system. Okay, in the sympathetic system, what receptors are in the sweat glands? This is the different one. Muscarinic. This type of, okay, remember, this is sympathetic. Should sympathetic have anything to do with muscarinic? No, muscarinic is what type of receptor? Cholinergic, acetylcholine, those type of drugs. But this is different for the sweat glands, so just know that that's the odd one. That's why I focus on that one. What four cranial nerves are responsible for your parasympathetic innervation?
3, 8, 9, and
3, 7, 9, and 10. Okay, what's the most important one? 10, vagus nerve. Okay, vagus nerve is what causes a lot of hiccups, causes that spasming. So one of the things you can do is you can cut the vagus nerve and it stops hiccups. Okay, what neurotransmitter and receptor combo is in all ganglions regardless of type of innervation? In all the ganglia. 2, acetylcholine to a nicotinic. They're in all the ganglia. After the ganglia in the sympathetic system, that's when you have the changes and the different ones that are released in the post-ganglionic synapse. Okay, what happens to the eye when your radial muscles are stimulated via sympathetic? Okay, we get mydriasis or dilation. What will an increase in parasympathetic innervation have on the heart rate? It's going to go lower. Okay, remember, what is parasympathetic? Rest and digest. We want to rest, the heart rate's going to come down. Increase in sympathetic innervation affects sphincter tone. What's going to happen with your sphincter tone? Constrict it, remember? We don't want to go to the bathroom when you're running away from something. What are the two types of receptors acetylcholine can bind to? Muscarinic and nicotinics. What two enzymes are responsible for metabolizing norepinephrine? COMT, MAO. Don't say MAOI. That's a drug, not a neurotransmitter or a metabolizer. Enzyme. What's the major inhibitory? GABA. Why?
chloride.
It opens the chloride channels. When now we have all this negative ions coming in, what happens to our resting membrane potential with all these negative? Hyperpolarizes. Does that make it easier or harder to get to threshold? Harder to get to threshold, therefore nothing's going to happen. That's why it's inhibitory. When you're studying, start putting these connections together. If you want, you can draw an entire neuron going to the end, and you can talk about the beginning part. You have the middle part, the soma. You have all the action potentials. You have the propagation of the action potential down that nerve. You have the end where the calcium channels are, the terminal boutins, where you have all the vesicles for your neurotransmitters that get released. What happens when they leave? Where do they go next? If you can go that step to that step and know everything in the middle, then you'll be okay. What receptor does the primary brain excitatory neurotransmitter bind to? What is the primary excitatory neurotransmitter in the brain? Glutamate. What does glutamate bind to? Remember, Namenda I gave you the example of, because they just took NMDA and made a word out of it. So Namenda is the name of the drug that affects those things. What neurotransmitter can help reduce pain stimulation and aid in sleep? Here's your serotonin. That's it. Let me pull up the Kahoot. So when we go through this Kahoot, we'll go through how to kind of like get some test taking strategies and how to like effective studying. AA guys, I'm trying to figure out if you guys have a test bank you have access to. I don't know if you have access to because the exam master that we have is only for PAs, like login. They have like broken down by like, so I hope you guys have one. I put an email to Selena and Ashley to find out. No exam, thanks, okay. Okay. Also, guys, I know you all probably use ChatGPT to write an essay or something, but they're very good at developing questions. So just type in ChatGPT, give me 10 physiology questions about whatever, and it'll spit out questions for you. Use it for studying. It helps. It'll come up on the bottom in a second, the code. It should pop up. Okay, so what fluid compartment contains the largest amount of fluid? Do you see the pin on the bottom? Whoever needed it. The pin's still there. So between intracellular, extracellular, which one has the most fluid? Okay, now, let's look at a test-taking strategy right here with this question. We have ICF and ECF, but then we have blood plasma and interstitial fluid. What is the formula? What makes up your extracellular fluid? Your blood plasma and the interstitial fluid. So those two answers are ECF. You know that can't be it, so it's got to be ICF. So you can work backwards sometimes if you don't know the answer to the question. Work backwards, it helps. Okay, which of the following is true regarding concentrations of ions? ECF is high in potassium, low in sodium and chloride, and then so on and so forth. So, no, which is the right combo? Okay. Everyone good on that one? Makes sense? Okay, which of the following is active membrane transport? It should be easy because the answer is in the word. So. Yeah. We know that active has to have ATP, so therefore any answer that has ATP is the right one. So, voltage-gated channels, what determines when they open up or close? Membrane potential. Remember, they're voltage-gated channels. Whenever that membrane voltage is, will determine if they open or close. Nothing to do with being active or passive, it's just the voltage tells it to do. Ligand-gated channels, what has to happen? You have to have a ligand bind to it, so the question doesn't say anything about anything binding to a receptor. Can't be ligand. GLUT transporters, just grab glucose out of the blood and bring it in. No need anything, so ATP. Okay. Well, we already gave this question 2 again, but hopefully we hear some popcorns and get this thing going fast. Okay, you give 3% saline. Which 2 answers are the same?
Burst and hypotonic.
Okay, there's 2 answers that are the same. Cells would burst, and if it's a hypotonic solution. We know if you give someone a hypotonic solution, what's going to happen to the cells? Swell up. Well, here we're talking about 3% saline, so it's a hypertonic solution. Okay, what ion most affects that resting membrane potential?
Everybody get both?
Okay, listen up. So let's go over this one. The main ion that influences it is potassium. Okay, sodium only matters with the depolarization, really, but the biggest weight is the potassium. Why is the weight the potassium? It's inside the cell. The majority of it's inside the cell, so it's going to have a big influence there. Now, that clinical correlation that goes with this one is very important to keep in your mind also about why potassium can be deadly. Usually happens in a lot of diabetic patients because kidneys don't work very well, so they get a buildup of potassium. What happens to that resting membrane potential as you increase the concentration of potassium in the blood? Gets closer to threshold. Remember, what's the normal resting membrane potential? -70. What's threshold? -55. So you have 15 units to get to threshold. If you increase the potassium, that resting membrane potential now can go to like 60. And now we only have 5 units to get to threshold. Makes it easier to get to threshold. And when this happens in the heart, every time that heart depolarizes, what do you think is going to happen to your heart? It's going to beat. So if you get rapid depolarizations, your heart is going to go very, very fast. If it goes too fast, you get into those lethal arrhythmias, ventricular tachycardia and ventricular fibrillation. Those are the bad ones. We don't want to get there. That's why potassium is so important for us. Okay, this one should be another easy one, but again, we'll use it to review. You guys went too fast, you don't read the answers. So make sure you read the questions totally.
It took me a while.
I know.
Okay, sodium going into the cell is your depolarization. Sodium out of the cell and potassium into the cell is done via what? Sodium, potassium, ATPase pump moves those directions. Potassium out of the cell is what? That's your repolarization. So now you've studied again 3 more topics based off of one question. So going through all those answers. And what's the fastest type of cell communication? Okay, let's go over this one. Synaptic transmission is slower compared to the gap junctions. Remember, gap junctions, like electrical synapses, they go very fast. Direct contact is nothing because you have cells touching all the time. Doesn't mean they communicate. They have to have that gap junction to allow things to go from cell to cell. Endocrine deals with blood, very, very, very slow. So it's got to go into the bloodstream, go through the blood system, get to the target, have an effect. Endocrine takes some time. So the fastest thing are those gap junctions. Just think of the heart. So the whole entire heart beats as one. And we already went through this one too. Okay, what do all enzymes end in? ACE. So you know all the ACEs are all enzymes. What is neostigmine? The drug. It inhibits acetylcholinesterase. That's the purpose of neostigmine. It's an acetylcholinesterase inhibitor. So we know it can't be that one. And myosin light chain, and those two are involved with what? Smooth muscle. And why is calcium so important? Okay, so this one. What type of muscle are we talking about in the question?
Skeletal.
So which answer can we get rid of immediately? Green. Why the green one could be removed immediately? That's only smooth muscle. So the answer is smooth muscle, but the question's talking about or asking about skeletal muscle. So that one could automatically be removed from your answer choices. Aids in depolarization. What is the only ion responsible for depolarization? Sodium. That can't be the answer when you're doing your exams. It allows the power stroke between actin and myosin to occur. What is actually involved with that power stroke? ATP is involved with it, not calcium. The only thing that calcium does, binds to troponin and exposes the active site. That's it. That's why calcium is important. If you don't have calcium, Not going to bind to troponin, won't activate that or expose that binding site. No contraction is going to happen. Which is why some of the class of drugs we give to reduce contraction are calcium channel blockers, CCBs, because they're going to reduce the amount of calcium coming into the cell, reducing the squeeze of the heart. When we talk about the squeeze of the heart, we're talking about the pressure it is generating, which is high blood pressure. So to reduce high blood pressure, we give calcium channel blockers, blocking the calcium from coming in, so you have a weaker contraction, bringing your blood pressure down. That's how calcium channel blockers work. So you guys understand now how to go through these answers and kind of like work backwards and you can reduce things and make it easier to answer questions. And here's the last one. I know it's a short one. And why is a latch bridge state so important? So we're talking about latch bridge. Is this skeletal or is this smooth muscle? Smooth. So which ones can we get rid of? There are no cross bridges. Remember, cross bridges means there's striations. Skeletal muscle and cardiac muscle is striated because of the cross bridges. So it can't be yellow. Green. What is green talking about? Postural tone, sitting up straight. Those are skeletal muscles, not smooth muscle. So here's an example of a question. I'm not trying to trick you, but you have to know what muscle we're talking about and which answers correlate with that muscle. And yep. Okay. Any other questions you guys have about the exam tomorrow? Any questions you guys have about content material? In general, anything? Okay, I'll post this now. The Kahoot will be posted, the Jeopardy will be posted, the lecture will be posted. Otherwise, I'll see you guys tomorrow morning for your exam. I'll try and check my email tonight until about 9. If you have any questions, I'll try and answer them. If not, I'll see you guys tomorrow morning. Good luck.